Hello everyone, I am Dr. Jyothirmay Hegde, ENT consultant at Columbia Asia Hospital, Whitefield. We work at the Department of ENT and Head and Neck Surgery at Columbia Asia Hospital. So the case services which we cater here at Columbia Asia Hospital are ear, nose, throat, head and neck surgery and skull-base surgery. If you take it in general, the conditions which we treat range even from children to adults to the geriatric age group. In children, usually we reach around the case services we cater are from common cold, infections, foreign bodies in the ear, nose, throat, advanced procedures like foreign body in the bronchus, which we call as bronchoscopy, foreign bodies in the esophagus called as esophagoscopy, or any other foreign bodies anywhere in the head and neck, we tend to remove it. In the adults, usually we deal with the infections, inflammatory conditions, tumors, which reach anywhere within the ear, nose, throat, head and neck, most commonly like the thyroid glands, submandibular glands, parotid glands, and the other conditions like infections and inflammatory conditions. Whereas in elderly, you have many other their own conditions like infections, inflammatory conditions, tumors anywhere in the head and neck. Along with that, certain diseases which are specific to the elderly age group like hearing loss and other conditions like nasal problems, the throat problems, voice related conditions which specifically occur to the elderly people. So these are the general ENT conditions which we cater to. Apart from this, we have special clinics or the specialty clinics which we offer at the Columbia Asia Hospital, Whitefield. To start with, the first among which is related to the balance or the hearing. So with regards to the balance, it's also called as the Vertigo Assessment Lab or the Balance Lab, wherein we treat specifically with the patients who have problems with the balance. As you are aware, one of the importance of the ear, apart from hearing, is with conversation to the balance. So we have a fully designated Vertigo lab or the hearing lab for the conditions who have either problem with the vertigo or with the hearing. So second thing is with regards to the allergy. Since in this part of the area of the Bangalore, there is a lot of cases who have conditions related to the allergy, allergic rhinitis, sinusitis, and other conditions which are related to the nose. So we cater to all these conditions with minimally invasive technique regarding to both nose and the sinus. The third specialty clinic which we offer is with regards to the speech and swallowing. We have a fully integrated speech and swallowing lab and we cater to all the conditions with respect to the speech and the swallowing. The next condition is with respect to the hearing and the Audiology Clinic. With so many children who they are born deaf, or even in adults later on they become deaf, we have a fully fledged audiology lab. We cater even to conditions like fully congenital hearing loss, and we offer even the cochlear implant, which is the highest state of the end operations which are done in case of hearing loss. Then is something related to sleep. Anything, the disorders which related to the sleep like snoring, sleep apnea. In nowadays, with the advent of so many things, with the abnormal lifestyle, the sleep apnea is one condition which is very common. So we cater to all the conditions with related to disorders of the sleep. We have a fully integrated sleep lab wherein we completely, after the admission, we completely evaluate for the disorders of the sleep, and we treat them for medical as well as surgical conditions related to disorder of the sleep. And last but not the least, we have something called as headache clinic. It being so common, we work as a common condition with the neurologist and the neurosurgeons, and we treat the conditions which are responsible for the various headache conditions. And last, we have something called as the advanced clinic. Myself are trained in that, in the endoscopic sinus and skull-base surgery. So I'll be discussing with this as we work with as a teamwork along with the neurosurgeon, and we cater to all the conditions with the help of a minimally invasive endoscopic skull-base surgery. Thank you.